Welcome to our YouTube channel, Ivory Dentistry. So guys, we came up with pharmacology series and the first topic is routes of drug administration. So we divided this topic into 3 parts and now we move on with part 1. So, what is a drug? It is a dry herb which is derived from a French word DROUGE and the substance used in diagnosis, prevention and treatment of a disease. So the drugs are administered in various routes and the way of drug administration depends on properties of drugs and patient's requirements. So here we see the map view of routes of administration. The first one is oral, second is parenteral, third is topical. So the enteral route, also called as oral route. Seeing this picture, we come to know that enteral route means the drug is taken orally. So the enteral route, other names are oral route, oral ingestion, intestinal route. This is the oldest and safest route of drug administration. This is most commonly used. So the large surface of GIT, gastrointestinal tract, the mixing of its contents and the different pHs at different levels of gut facilitates effective absorption of drug orally. As we all know, gut is made up of bacterial flora, few enzymes and acids are also secreted. This all makes the drugs destroyed before they reach the desired site. So the advantages are, this is the safest route, most convenient route, most economical route, and the patient can self-administrate. This is non-invasive route, which means no instruments are used. So the disadvantages are, onset of action is slow because absorption needs time. The irritant and unpalatable drugs are not administered because this may lead to vomitings. Some drugs cannot be absorbed due to certain physical and chemical characteristics. Example, streptomycin, which is not effective orally. So the irritation to GIT may lead to vomitings, as I said before. There may be irregularities in absorption. Some drugs are destroyed by the gastric juices. Example, insulin. This is the hormone which is given in subcutaneous injections, which we come later on. So the oral preparations are not given to unconscious and uncooperative patients. Some drugs undergo extensive first-pass metabolism in the liver. This means first-pass metabolism means the phenomena in which the drug is absorbed before it gets reached to the desired site. So to overcome all these disadvantages, the irritants are given as capsules. The bitter drugs are given as sugar-coated tablets. Some drugs are coated with substances like synthetic resins, gums, sugars, coloring and flavoring agents, making these tablets more acceptable by patients. So the enteric coated tablets looks like this. Enteric coated tablets. The tablets are coated with cellulose acetate, phthalate, gluten, etc. These are not digested by the gastric acids but gets disintegrated into the alkaline juices of intestines. This prevents gastric irritation, avoids destruction of drug by stomach, provides higher concentration of drug in its small intestine. This retards absorption and prolongs the duration of action. If coating is inappropriate, the tablet may be expelled out without being absorbed at all. So the controlled release and the sustained release preparations are designed to prolong the rate of absorption and the duration of action of drug. This is very useful in short-acting drugs. Nowadays, these controlled release preparations are coated with a semi-permeable membrane through which water enters and dispels the drug out. So the advantages are frequency of administration can be reduced, therapeutic concentrations are maintained, which mean nocturnal symptoms are to be treated. Nocturnal means which are active at night, like nocturnal animals. Disadvantages are failure of preparation releases entire amount of drug in a very short time, leading to toxicity, means poisoning. So these are more expensive tablets. So the precautions to be taken are the capsules or tablets are to be swallowed with a glass of water. Patient sitting in an upright position or standing in an upright position. This facilitates passage of tablet into the stomach and rapid dissolution occurs. Minimises chances of getting drug into larynx or behind epiglottis. So the recumbent patients should not be given orally because the drug remains in the esophagus due to absence of gravitational force facilitating the passage of drug into stomach. Recumbent patients means the patients who are lying on the bed. So when they are lying on the bed, the gravitational force is very low and the tablet may get stuck in the esophagus itself. So such drugs causes damage to the esophageal mucosa. Example are of iron salts, tetracyclines. Though enteral route includes oral injection, sublingual and rectal administration are also considered. Enteral route includes oral injection, but sublingual and rectal administration also come under enteral route. As you see in the first picture, this is oral injection where we take tablet with a glass of water, and the next is of sublingual administration where the tablets are placed under the tongue. The word itself says. And the rectal administration, the tablet is inserted into the rectum. Now we move on to parenteral route. The route other than enteral route is parenteral route, and the drugs are delivered directly into the tissue fluids or blood. The advantages are it is more rapid in action, it is predictable than orally, can be employed in unconscious and uncooperative patients. The gastric irritants can also be given. The irritation to GIT is avoided. Can be used in patients with vomitings or unable to swallow food. The digestion by gastric and intestinal juices are also avoided, and the first pass metabolism is also avoided because the drugs are not given orally, they are directly sent into the blood. So in emergencies, this route is very useful because of its rapid action, predictability and useful in unconscious patients. The disadvantages are asepsis is to be maintained. Asepsis means the exclusion of microorganisms or bacteria from the skin, and the injections are very painful. This is more expensive, less safe and inconvenient to patients. The injury to nerves and other tissues may occur. So the parenteral route includes injections, inhalations, transdermal, transmucosal. So the types are shown here. The intermuscular is given with the injection at 90 degrees angle straight into the skin. Subcutaneous is given in the angle of 45 degrees and intravenous is given in the angle of 25 degrees. Intradermal is given to the epidermis in the angle of 10 to 15 degrees. So the injections include intradermal, subcutaneous, intramuscular, intravenous, intraarterial, intrathecal, intraarticular, intramedullary. This is part 1. Hope you like it. Please like, share and subscribe to our channel. And let's continue part 2 in the other video. Please watch it.